I'd like to welcome everyone to the University of North Carolina at Chapel Hill Department of Otolaryngology, of course, virtually during this 2020 pandemic. I would like to just tell you a little bit about our physical plant and our department. This is our hospital complex. All the hospitals are connected, and there's not a lot of travel between these except for walking, which is really convenient. I would like to tell you a little bit about some of our newer clinics and newer facilities. This is our new clinic at Meadowmont. You can see the 5 guys. That's critical for lunchtime. This is our new clinic in the Cancer Hospital, which is on the 2nd floor. It's a lovely facility. And coming during your time will be the new surgical tower, which is under construction. This is going to house ICUs and operating rooms, and it'll be, of course, a state-of-the-art facility. It'll also be attached to the other hospitals. So a little bit about UNC and the Department of Otolaryngology. It was founded in 1952 by Newton Fisher at the newly formed UNC School of Medicine. In 2001, it became a department under Dr. Pillsbury, and in 2018, I was named the 3rd chair of the department. It's had a long history of being well respected and in the top 40 in the U.S. News and World Report since before 2015. UNC is a big research institution, and I just want to tell you a little bit of the accolades that have come in recent years. Otolaryngology is involved in much of this research. In 2019, the Blue Ridge rankings placed UNC ENT 26th in the nation, and I have no doubt that when the 2020 rankings come out, we will be even higher because we attained some significant awards. The same year, UNC was ranked 5th for federal research funding in the nation with $1.1 billion, and more than half of this being from the School of Medicine. In 2018, UNC was 99th percentile nationally for federal research grants and contracts among public schools. Like many places I'm sure you'll be visiting, UNC is a large academic research institution, and our residents are well represented in this. I think our residents ranked 5th nationally in publications last year. So a little bit about our divisions. We have 6 divisions, multiple faculty in each division, and I'll just go through those one by one to tell you a little bit about them and about the faculty members who are in each division. So starting with facial plastic and reconstructive surgery, Dr. Shockley founded this division, has been here for a long time, stepped down last year as Dr. Clark took over the division chief. And in 2021, we're very happy to have Matt Miller joining us to further bolster our facial reanimation and facial nerve center. Here's some of the activities of the facial plastic division. You can see the facial rejuvenation, periorbital surgery, skin cancer reconstruction. I mentioned the facial nerve center with Dr. Miller coming in July, and major facial reconstructions. You can see on the right, not only do we make people look good and their noses look good, but we also reconstruct noses. The near nasal reconstruction on the bottom, I think, is a pretty outstanding result. Division Head Neck Oncology has 7 members. Dr. Weissler was the original division chief for this. He's in phased retirement now, and Dr. Patel is the new division chief. We have several very prominent faculty members who are nationally recognized. Dr. Lumley's our newest faculty addition. And Dr. Trunk just recently received a K Award. And Katie Vogler is our first PA. We're also have an offer out for a second PA. The Division of Head and Neck Oncology is a robust and very busy division with a lot of free flaps and extirpative surgery. You can see more than 300 minimally invasive salivary procedures, growing robotic surgery, a lot of grants and trial funding with more than 10 active treatment trials, a UA1, a SPORE project, R1, and a KOA. And facial reanimation surgery along with facial plastic surgery is a new and expanding program. Otology-Neurotology, and skull-based surgery. Dr. Pillsbury, of course, is in this division. He's also in phased retirement. Dr. Brown's the division chief. And this is also a very active division with a lot of research as well. Cochlear implantation, one of the busiest centers in the nation, if not the busiest center in the nation. A lot of skull-based work as well, and hosted the 2019 International Hearing Meeting and the 2020 International Conference on Cochlear Implants. This program is one of our shining stars, does a lot of work with pediatrics in our pediatric division, as well as with adults. Speaking of pediatric otolaryngology, here's our pediatric division. Dr. Zadansky is the division chief. Our newest faculty member is Dr. Duty. We have opened up a clinic in Raleigh, and Dr. Duty's there probably more than the rest of the faculty, but the other faculty rotate there as well. A busy pediatric otolaryngology service that's a full service division, more than 2,500 operative cases, involved in a lot of multidisciplinary teams, as you can see there, including one of the original craniofacial teams that was at UNC, and Dr. Drake leads. And I mentioned the expansion to Raleigh, which is just getting off the ground and growing quite nicely. Rhinology, allergy, and endoscopic skull-based surgery is a robust division. Lots of faculty members you can see there. Dr. Kemple's the newest addition, has a KL2 grant, and Dr. Senior is the division chief. This is a very active division with a lot of surgical volume, greater than 700 cases, a big skull base practice, and you can see the different surgeries that are done there, as well as standard and revision functional endoscopic sinus surgery. The research is also very robust in this division with a lot of publications and involvement of learners. General otolaryngology, Dr. Lynn's our newest faculty member in this division, led by Dr. DeMason. A very active and expanding division with a focus on sleep medicine and sleep surgery. You can see the implants that are being done there. And this is our latest expansion of this division into Chatham County. Division of Voice and Swallowing, all of you are probably very familiar with Dr. Buckmeyer and Dr. Shaw, who are our program director and associate program director. They're both in Division of Voice and Swallowing. Very active in office-based procedures with a lot of office-based procedures. As you can see there, more than 350 procedures yearly. Also involved in open endoscopic airway and swallowing procedures, as you can see, and the multidisciplinary diagnosis treatment of the complete voice and swallowing disorder spectrum. And of course, academic education contributions, 30 national presentations, and training is very involved in this division as well. Wake Med is our community ENT experience. You can see the providers there that you'll be working with, and at the bottom is the Wake Med Hospital complex. The research faculty has been expanding. It's an excellent research faculty. Emily Buss is the vice chair of research and leads this group. A large portion of these investigators work on hearing and audiology, but Dr. Isieva works on head and neck oncology, and Dr. Olshan in population health and head and neck oncology. Some of the accomplishments, you can see the grant funding to the left. A lot of federal grants support this group, as well as clinical trials, and those 7 clinical trials exclude head and neck trials, which are run through the Cancer Center, and some foundation grants. This portfolio has been expanding, as I mentioned earlier, and I expect that our Blue Ridge ranking will increase with the 2020 update when it comes out. The Head and Neck Oncology Lab works on several projects, including demethylation as therapy and prognostic biomarkers. There's several hearing and audiology labs, including the Audiology Physiology Lab that works with humans and animals to study cochlear physiology. The Hearing Research Lab behavioral and EP studies of hearing across the lifespan, and the Auditory Research Neuroscience Lab, looking at mechanisms of auditory processing focused on patients with hearing loss. And finally, there's the ENT Computing and Clinical Research Lab, which is engaged with a lot of our divisions to do computer modeling primarily of airways and airflow, and also looking at drug delivery to different areas, including the nose and larynx. So I'd just like to welcome you to Chapel Hill. I hope you have a great virtual interview day. And of course, if there's any other information we can provide for you, please let us know.